Good evening, I'm Robbie Alampay. You're still watching The Big Story. Oxygen supply supposedly may still be enough for now, but with COVID-19 patients in home care rushing to get their own supplies, could there be a looming shortage in oxygen here in the Philippines? Mobile journalist Stanley Gajete gives us the front seat to that story.
Medical oxygen is key to treating people with respiratory diseases, whether they are at home or in hospitals. According to the World Health Organization, 1 out of 5 suffering from COVID-19 needs medical oxygen to ensure oxygen in their blood is sufficient. At the peak of the surge in Metro Manila, the DOH told medical oxygen suppliers to start regulating the distribution and sale of oxygen. With so many people rushing to buy oxygen on their own, hospitals were starting to feel the pinch in supply.
This is not rational, no? Kasi una, it might cause you harm kung hindi nyo naman po talaga kailangan. Pangalawa, baka naman po yung pong supply ng ospital ay na madedeplete.
Medical oxygen supplier Aline Clerigo said at one point they were having trouble meeting the demand.
Before the peak of the pandemic, sobrang dami naming supplies. So when the peak came, talagang ubos siya.
With hospitals brimming with COVID patients, demand for oxygen has spiked. Patients who are confined at home are placing added pressure on the supply.
They would rather na bumili na sila ng oxygen tank na hindi na nga sila ma-admit sa ospital pagkatapos hindi pa natin maibibigay yung needed na autotherapy support na kakailanganin ng mga pasyente.
But images from India are raising concerns over oxygen supply. Lisander Ragodon is medical director of Providence Hospital. He says because of this, hospitals are carefully and constantly recomputing their oxygen requirements.
Now, assuming there were going to be shortage or anticipated shortage, we need also to limit also the number of patients because you won't be able to manage them well.
For now, Ragodon says the demand for oxygen may be manageable, but preparing in case they reach the red line.
Nobody can tell, no one can tell about if there were going to be shortage. It depends upon to the number of cases then.
Stanley Gajete, We Are One News.